Welcome to Ask Dr. Aviva. This is Dr. Aviva Romm. This week's question is about antibiotics for fluid in kids' ears. Here's the question. Hi, Dr. Aviva. I'm trying to do the best for my kid and wanted your feedback. She has thick fluid in her ear and the ENT suggests an antibiotic to break up the fluid. Stuff I'm not quite understanding. Her hearing is technically affected, though she's not showing it and there's no damage. But as long as the fluid is there, she has hearing loss, even if it's just for sounds that are very low. I wonder if you have any herbal or homeopathic suggestions for me to read up on and look into. I'm a big follower of your Facebook posts and I thank you so much for the awesome work you do. Hi, lovely mama. Thank you for writing and I'm so glad you're enjoying my Facebook posts. And yes, you're asking a great question, brava, in questioning whether an antibiotic prescription is necessary for your kiddo. I bet a lot of other parents have this question too. Here's the medical bottom line. While antibiotics are generally not considered necessary for what is called otitis with effusion, or fluid in the ear like your kiddo has when there's no infection, or actually even for most ear infections, pediatric medicine does consider it reasonable and appropriate to try an antibiotic if there's been fluid in the ears for weeks or months that doesn't go away otherwise. In my practice, I generally try natural remedies for a few weeks to avoid antibiotic use when I can, especially when it might not be necessary. So here are some natural remedies for otitis with effusion. My big go-to is a supplement called NAC, or N-acetylcysteine. There's very good data on its safety and effectiveness for actually exactly this purpose in kids and adults. A typical dose is anywhere from 300 to 900 milligrams a day, depending on your child's age. NAC is available in health food stores and online, and it may take several weeks to work. You can open up the capsules for very young kids and put the powder into some applesauce or something else that they'd like to take. Quercetin and freeze-dried nettles are also powerful for clearing up fluids in the ears. They're natural antihistamines from foods and herbal sources that don't cause you to get overly dried out and don't cause drowsiness. Classic herbs include eyebright and plantain, which can be given in tincture form and used with the NAC. I also recommend my kids' fire cider recipe, which I'm sharing here and can also be found in my Healthiest Kids University courses. Consider doing an herbal steam every day for 3 to 5 days to help loosen the congestion in the ear canals. Simply put a few drops of oregano, thyme, or peppermint essential oil on a washcloth, throw that under the shower with the water running hot, and just shut the bathroom door for about 5 minutes to build up steam. Then you just take your kiddo into the bathroom to inhale the steam for about 5 to 10 minutes. Don't go into the shower, just the bathroom. It's also really important to look for root causes whenever there's fluid in the ear. Allergies are the most common, either something in the environment or foods. I typically recommend a couple of weeks of removing juice, dairy, and sometimes even gluten-containing products. Often just removing the juice and the dairy helps a lot. For more on allergies in kids and additional supplements on otitis media with effusion, my kids' online courses, Healthy All Year, and the Allergy Epidemic are chock full of information on this if you want a deeper dive. And to find out more about those courses, simply go to www.healthiestkids.com. I hope this information has been really helpful for you and that fluid clears up pretty easily.